We got a great question from one of my followers, Rez from New York. And Rez is asking about blood clots. What are the risk factors for blood clots when you're having surgery? This is a very important topic, and we got a lot to discuss, and I'll try and do it as quickly as I can and make sure you get all the information you need. But this is important. The way that you get clots is in laying in surgery, being perfectly still. You're not doing things that you normally do when you're awake and moving around. Even when you're sleeping, you still generally move in your sleep, and so that little bit of motion makes the blood flow. And it's not the same as being under anesthesia where you're perfectly still and not moving at all. When you're up walking around, even more so, pumping your muscles and getting blood flow. So when you're under anesthesia, you're laying perfectly still, not moving, and you get what's called stasis, meaning that the blood can sort of sit there and it doesn't flow through the veins the way it normally would. Because that blood's not flowing, it can form clots. Now, getting a clot in the veins in your legs, which is usually where they come from, is not that big a deal so long as it doesn't cause any problems by breaking off and traveling to other parts of your body. We do get some small clots in the legs all the time that we never know about because your body just gets rid of them and they go away and don't cause any problems. When you have a big clot that forms in your legs and little bits of it break off and travel through your bloodstream into your heart and then into your lungs, well, that makes a problem. That takes what's a DVT, or deep vein thrombosis, thrombosis meaning a clot, and it makes it into a pulmonary embolus. Pulmonary is lungs, and the embolus means it went from one place and traveled off to go to another. So these PE, or pulmonary embolisms, are the really dangerous ones. You know, when the blood clot breaks off and travels and blocks up blood flow in the lungs, you're not exchanging oxygen. That's where it becomes life-threatening because you obviously need oxygen to live. And so if you're not getting enough oxygen into your bloodstream, that can be life-threatening. Now, there are things that we do to try and decrease the risk when we're doing surgery. You can use certain medications that'll thin the blood, and that makes it less likely for you to develop these kind of problems. You can also use these mechanical squeezy devices called SCDs, or sequential compression devices, that will massage your calves when you're sleeping. And that massage that it does is this sequential squeezing that makes the blood flow. So you never actually have them sitting still, there's no stasis, and you decrease the risk of developing these kind of clots. These are really the only two things that have ever been shown to decrease the risk of developing DVTs, and then ultimately PE. Now, there are certain risk factors that can make you more likely to get these problems. One would be advanced age. Anyone over the age of 60 or 65 has a little bit increased risk. Being pregnant, which is usually not a problem because we don't do cosmetic surgery on pregnant people, but being on birth control pills. The hormone therapy that is used for birth control it can be very similar in risk to being pregnant, and it can increase your risk of having blood clots. Smoking. That's one of the things that you can do that will increase your risk, and you can just avoid that and not smoke, and it decreases so many other risks. Don't even get me started on that. And obesity. When you're overweight significantly, all of that weight and pressure around the veins, well, that can also increase your risk for DVT. And then having a DVT puts you at increased risk for PE. So these are some of the things you can control, some of the things you can't control to decrease your risk of getting a DVT. And speak with your doctor about using things like SCDs, sequential compression devices, to massage your calves while you're sleeping to decrease your risk. When it comes to the blood thinning medication, some doctors like to use it, other doctors don't. It depends on your risk profile. Sometimes it's a good idea and sometimes it's not. The downside of the blood thinning medications is it does actually increase the risk of bleeding because it thins your blood, when we can't use certain types of them in certain types of surgery. So I personally don't like using blood thinning medication and would only use it after surgery for high-risk patients to try and decrease that risk. Speak with your surgeon and see what he or she has in mind. Try and limit things like smoking. Try and lose weight if you're overweight before having surgery, and put yourself in a healthier place. If you're taking any kind of birth control medications, maybe think about not taking them for a couple of weeks leading into surgery. That can help decrease your risk. And make sure you know the plan of the surgeon. Surgery can be done very safely. Try and decrease your risk of developing these clots, and you're going to have, hopefully, a fantastic result and get there safely.